DOE's worker health and mortality studies began in the early 1960s when the feasibility of using existing employee and facility records for conducting long-term follow-up studies was explored. Based on the promising findings from this feasibility study, a 5-year pilot study was initiated in 1964. The primary DOE sites selected for this pilot study were Hanford in the state of Washington and the Oak Ridge site in Tennessee. Other facilities operating at several smaller sites were also included. To obtain the information needed for a retrospective cohort study, considerable effort was expended on locating, copying, and abstracting data from various plant records. When it was determined that further processing and validation of these data would be necessary to ensure their proper use in epidemiologic studies, the cohort study at Hanford became the primary focus of the health and mortality studies. In the 1970s, the study was expanded and the responsibility for collecting and updating data for subsequent long-term worker studies was assigned to 3 epidemiologic research centers: the Center for Epidemiologic Research at Oak Ridge Associated Universities, Los Alamos National Laboratory, and Hanford. ORAU assumed responsibility for studies of worker populations at the Oak Ridge site, which included the K-25 facility, the Y-12 facility, and the X-10 facility, also known as the Oak Ridge National Laboratory, or ORNL, as well as several other sites in Kentucky, Ohio, Missouri, and South Carolina. ORAU prepared a master roster of all contractor employees at each of these facilities and retrieved many of the death certificates for the 3 epidemiologic research groups. Each research group then extracted and coded the cause of death information from the death certificates for use in their respective studies. The coding was done in accordance with the International Classification of Diseases. Each worker was assigned a unique identifier, a number that allowed information pertaining to that worker to be linked together, regardless of the research center that collected the data or the file in which it appeared. The Epidemiologic Research Group at Los Alamos National Laboratory assumed responsibility for studies of workers monitored for exposure to plutonium. The Epidemiologic Research Team at Hanford took primary responsibility for studying the operations workers at Hanford. Data were regularly collected by the 3 epidemiologic research centers. Each center used slightly different procedures and methodologies to merge, document, validate, and analyze the data. The work performed by the 3 epidemiologic research centers, as well as other researchers, culminating from the pilot study beginning in the 1960s, resulted in the collection of valuable information on a large number of workers at DOE sites. The electronic data files generated in the course of these worker studies are located in CEDR. You have just learned about the DOE worker health mortality studies included in the CEDR program. If you would like more information, please visit our website shown on the screen.